Teleconsults have become the new way to provide care to patients since the COVID pandemic began in March of 2020. Teleconsultation is defined as synchronous or asynchronous consultation using information and communication technology to omit geographical and functional distance. Teleconsults can be performed via telephone or via video utilizing a secure HIPAA-compliant platform. State laws regarding the method of communication, who can communicate with whom, and other limitations must be taken in account. We began to discuss this concept in September of 2019, and it took the pandemic to bring it to fruition. As you know, we have researched and began to provide travel consultations utilizing this technology beginning in July of 2020. We initially opened the service in Massachusetts. Clients self-scheduled via the Passport Health online scheduler. Our model was to have the nurse contact the client and discuss their travel plans and any required or recommended vaccinations or medications according to CDC recommendations. We obtained consent and discuss at the start of the call what the expectations of the client are for the call. The client is expected to complete their medical history and travel plans in the online scheduler or via paper and email it to the nurse prior to the consultation. We also include a medical history form. The client expects the nurse to provide quality education that he or she would receive in a face-to-face consultation. All their questions are expected to be answered and all of their concerns met. An appointment is then scheduled for the client to go into a brick and mortar office to receive any vaccines or medications that may be needed for a safe and healthy trip. As the pandemic has continued, we have expanded the opportunities for this service in Utah, Georgia, South Carolina, Florida, and Texas. After we reviewed all of the state regulations pertaining to telemedicine, we were able to provide this service in those states. We are having to look at the other states to see what we can and cannot provide. We trained nurses in each of these states how to perform the consultation and how to use the telemedicine platform. We now have data back to make any decisions regarding to expand or continue to use this service at our current levels of participation. We have had 52 consultations scheduled. Of the 52, only 9 have been completed to include vaccination in the clinic. The majority, 30, did not know they had scheduled themselves for teleconsults, or they wanted to be seen in an office and receive services at the same time, or they were physically going to be in a state where the nurse was not licensed to perform teleconsults. 7 people just didn't show up for the consultation, and they didn't respond to the nurse as to why they did not show. While these statistics may not be earth-shattering, the teleconsult is a new concept to travel medicine. The typical person seeking a traditional teleconsult is ill, and they're seeking medication for an illness. They expect to connect with a medical professional and have a medication waiting in a local pharmacy within an hour. The teleconsult for the traveler provides a consultation at a convenient time and location for the client. The visit for the vaccines can be as little as 15 minutes if the services are prepaid and all of the education is received during the teleconsult. Using nurses with compact licenses, consultations can be provided in the evening or early morning or at a convenient time for the client. The nursing compact allows for nurses in 34 states to provide services in another compact state if their state participates in the compact. As our schedules are filling up and the nurse pool is not growing with the needed schedules, teleconsults should become more popular and necessary. Utilization of the nurses with compact licenses who have open time in their days to perform the consults for the nurse that has a full schedule will assist in keeping both busy and provide income for both nurses. The visit for vaccine administration will be 15 to 30 minutes, allowing for a busy nurse to provide more vaccines during the day and have just that type of appointments for her services. And more people will travel protected. Since our trial has not been very successful, I feel we need to continue our efforts with the teleconsult process. We've noticed a significant increase in the requests for appointments for travel for Africa during the past week. As the yellow fever vaccine is only available in a limited number of locations throughout the United States, and our offices are only open a limited number of hours each week, we should see an increase in the requests or the availability of teleconsult opportunities for our clients and our nurses. I would recommend we continue to pursue nurses who would like the opportunity to perform the teleconsultations. We do need to include the services under our new compensation program and discuss how to equitably pay the nurses for their expertise and their recommendations that they're providing to clients to travel healthy and safe.